Mr. Rajkumar, Executive Director of MNC Pharmaceuticals, to take over the proceedings of the program. Over to Mr. Rajkumar.
Thank you, Raj.
It's indeed my pleasure.
Foundation. Dr. V.S. Natarajan is a giant in the field of geriatrics. He was born in Sankarapalayam village in Periyar district. After completing his MBBS from Madurai Medical College, he went on to complete his MD from Madras Medical College. Dr. V.S. Natarajan was the first Indian to undergo training in geriatric medicine in UK. He received the MRCP degree and obtained accreditation as a specialist in geriatric medicine. He is the pioneer in establishing an outpatient wing in geriatric medicine in Madras Medical College and Hospital, Chennai. He became the first person in India to be appointed as Professor of Geriatric Medicine at Madras Medical College. Dr. V.S. Natarajan is also the recipient of the most coveted, the Dr. B.C. Roy National Award for the Development of Geriatrics. The British Geriatric Society conferred on Dr. V.S. Natarajan the 50th Anniversary Gold Medal in London. He was awarded the Padma Shri Award in the year 2012 for his exemplary services to the elderly. Dr. V.S. Natarajan was also presented with Vayoshrestha Samman National Award for his dedicated service towards the welfare of the elderly community. An ardent devotee of Adi Parasakti and His Holiness Arul Thiru Bangaru Adigala, he serves rural elderly of that region through his services at the main Maravattur Adi Parasakti Institute. With 4 decades of service to the elderly in his personal capacity, Dr. V.S. Natarajan instituted Dr. V.S. Natarajan Geriatric Foundation in the year 2017 with a mission of happy elderhood. The comprehensive geriatric health camp was organized to detect silent diseases among the elderly. As part of preventive geriatrics, Geriatric Immunization Center was started and a campaign on adult vaccination was launched. Since mortality and morbidity are common consequences of falls among elderly, a short video film was launched about falls. A pledge against elder abuse was carried out on June 15th of every year as part of World Elder Abuse Awareness Day in schools. With the coordination of the foundation, Meals on Wheels program was started at Tenkasi. The foundation extends its reach beyond Chennai by starting Geriatric Community Care Center at Erode. To support sick and bedridden elders at their residences, the Geriatric House Call program was started. A memory clinic was started to nurture the mental health of elders. Dr. V.S. Natarajan has also authored more than 40 books in English and Tamil. He also published Mudumai Enum Pungatru, an exclusive magazine for the elderly. Dr. V.S. Natarajan Geriatric Foundation on a regular basis conducts yoga at home for seniors via Zoom Meet on a weekly basis. Dr. V.S. Natarajan Geriatric Foundation continue to serve elderly with the objective of a happy elderhood.
At just the age of 82, these programs are quite packed. Don't think about retirement. We have a lot of responsibility to contribute, responsibility to the society, sir. So you're always has been inspiring. And he's the first professor of geriatrics in India, and we are all privileged to have him here. And he is instrumental to have Department of Geriatrics for the first time in India in Madras Medical College. Of course, he is a retired professor and now the Department of Geriatrics from Madras Medical College. All his award winning, which we have seen. And here today, we are here along with Dr. V.S. Natarajan Geriatric Foundation and Venkateshwara Hospital. There is a CME on the basics of geriatric house call, and we are only a small supporter co-hoster, and this is organized with the help of Venkateshwara Hospitals and Dr. V.S. Natarajan Geriatric Foundation and Mr. Rajashekharan, and he's the backbone, supports doctor in all aspects, co-founder and managing trustee, and I used to get inspired with him. Because Mr. Rajashekharan has worked in hotel industry as well as medical conference management industry. One fine day he got inspired with the kind of work Dr. V.S. Natarajan Foundation is doing. He left all around the job, corporate job, and he took this responsibility because he knows that there is some time everyone have to come forward and contribute to society. Of course, thanks a lot, Rashekhan, and his contribution to us also in many ways. We have been a part of this Muduvai Pungatar book, and we give our advertisements. And doctor has been traveling to Tenkasi for the last 30 years. Only 1 year, I think, in COVID-19, 1 or 2 years he has missed. Last year also, this year also we have done it. The program is over. In the month of January it happened. October it happened. Last 30 years doctor has been traveling there. He goes and stays there for 2 days, and more than 200 patients, the elderly patient comes. We also supported by conducting a diabetic neuropathy reduction camp, anemia reduction camp and all. The entire team is now involved because everyone has understand how important, and they all developed a passion. Sir infused the passion to the entire team. That's why we are together with them. And today all of us are here, and there is very interesting 2 databases which I wanted to present. Of course, that will be in detail presented by Dr. Shankar. Serving the elderly, I have very interesting data. The most significant social transformation of 21st century is going to be, this is what the most significant transformation. There are nearly 138 million elderly persons in India, 2021, approximately 14 crores, 7 crores, 6.7 crores men and 7 crores women are there. You can see the statistically much higher increase, significantly higher increase. 34 million elderly patients was added in last 1 decade alone, from 2011 to 2021. That is 3.5 crores. By 2031, we will have another 5.6 crores will be added to this. On aggregate, the elderly population is projected, they are projected to rise at 33% on average between 2011 to 2021. The general population has risen only 12%. I am telling elderly here, it is 60, above 60 years and above are categorized as an elderly population. The decadal growth, we can see there is a 2 graphs which are traveling in 2 different directions. This is a population data census, and the elderly population has been growing at much higher pace than the general population. Let us again align towards the need. The increase in share of older persons in the population has implications nearly in all sections of the society, labor and financial markets, demand for goods and services, which is aligned towards the elderly population, such as housing, transportation, social protection, as well as family structure and intergenerational ties, because the generation gap will become much higher now because of the life expectancy significantly have gone up. Specialist healthcare for geriatrics is the most important behavior change which is expected from all of us. Kerala, Tamil Nadu, Himachal Pradesh, Punjab and Andhra Pradesh state have the highest proportion of elderly. Kerala is number 1, followed by Tamil Nadu. Kerala is having as a 16.5% of the population are presently on elderly, and it is significantly expected to go up in the coming years. Maybe from the next decade we will have more than 20%. And Tamil Nadu is not left behind. We also have around 15.6% of Tamil Nadu population belongs to this category. So the 3 emotional needs, the elderly needs, is the first one is safety and security. All of us may not know that the older adults fear falling more than robbery, financial stress or health issues. That is why Sir has made an excellent video called Vidudal. There is a video. So the biggest challenge they have is fear of falling. Our aim is to help how to prevent them, how to give them confidence that they don't fall. And the database shows that this is much bigger fear than robbery, financial stress, health issues. Connection. People need connection no matter of their age. This is the next expectation, emotional need. Autonomy. Seniors are independent. All along, all of us has been independent in our needs. Once we progress to seniors and we depend on others, that is the stage where we need to support. And healthcare logistics support is a major concern. 30 years from now, elderly population expected to be 18% all India. Already we have in Tamil Nadu, Kerala is around 18%, but all India it starts as low as 6.5%. The average is around 12%. So it will become 18%. 35 crore people we will have by 2050. Elderly population. The biggest challenge is 30% of calls which we get in the helpline numbers to get the information. They don't have an access to information. 15% calls we get the helpline or help related to the legal and pension issues. This is another need of them. 5% calls for the emotional support and logistical issues. These are all the challenges these elders will go through, and all of us here have a responsibility to ensure that we are here to support them. The biggest social transformation of the century, this decade, is going to be the elderly population is going to be on the high side. At this juncture, I sincerely request the youngsters and a society that does not value the elder people denies its roots and endangers its futures. The famous quote by Nelson Mandela. So I so happy today that Dr. Level, sir, as a leading consultant here, has completed his medical degree in 1982 from Chennai Medical College, and he has done his MD General Medicine and DM Doctorate in Cardiology from Madras Medical College in 1991. He was the best outgoing student in his batch, and he was a topper in the university. He is the first DM Cardiology qualified super specialist among the Tirunelveli Medical College students. He was awarded the Fellowship of Royal Qualification at Glasgow and Fellowship of the American College of Cardiology, and he has got numerous awards like credits like the Rajiv Gandhi Award of Best Doctor Award presented by Governor of Tamil Nadu at the Medical University, Lifetime Achievement Award and Appreciation Award for extraordinary working during COVID-19 pandemic, COVID Warrior Award by Lions Club International and Marwari Charitable Trust, Maruthuva Nakshatram Award by Health Minister of Tamil Nadu at the time of Tamil Nadu Dr. Tamil Nadu Dr. NGR Medical University, 31/7/2021, to name a few. Doctor has been involved in a lot of free medical services through free first aid medical service center in Chennai, free cardiac consultation offered all Thursdays at Venkateshwara Hospital, the same center here, the state-of-the-art world-class center here. He is dedicating himself one day for extending, in spite of his busy schedule, one day a free consultation. He has given 243 BP apparatus so far to the village people where it is required. Free medical education for 46 downtrodden girl students and provided them a placement opportunity in the same hospital or known hospitals. That has been a significant contribution. Otherwise, these girls would have been doing agriculture labor works. That is a significant contribution which he has done to society. As a social responsible citizen, sir has planted 9,000 trees and going to achieve a milestone of 10,000 at the earliest. We wish sir achieves that milestone at the earliest of 10,000 trees. And sir is happily married with Mrs. Leela Valli and has 2 children. Both are doctors. Dr. Subhash Chandra is a consultant cardiologist at Cancer Institute, and Dr. Sri Sindhuja is a dermatologist and cosmetologist in Chennai. This is a brief introduction about doctor. Everyone knows about the doctor, but there is little information that how concerned about the society. Now he just takes his concern to the next level. More than me, he is the right person to come forward and tell us how he is going to take his concern to the next level. And we are quite pleased such a top consultant like Dr. Thalewal sir is coming forward and joining this will give a great impetus to Dr. V.S. Natarajan Geriatric Foundation, and the team will have a great moral strength today onwards when sir personality is such a tall personality like sir coming forward and being a part of this foundation. And we request you sir to please come forward and this is a thank you.
To everybody. It's a really pleasant privilege in the presence of Dr. V.S. Natarajan. We call him as a very simple Natarajan sir. I was amazed by his simplicity and astonished by his passion for helping people. We are grateful for your association and the help and guidance for us, sir. And you know about Venkateshwara Hospital. You know, it's located in the heart of the city with a special focus on heart care and critical care. And last 2 years we are in COVID care also. So we are dedicating ourselves for elderly care. There are many reasons for that. Some of the personal reasons are I myself have 4 elderly at home from the age of 82 to 90. My father-in-law, mother-in-law, my father and my mother, all 4 with me now. They are aged from 82 to 90 years. I know how difficult, how challenging, how much care they need, both physically, mentally, emotionally, and socially. So I really understand I'm with you. And I would like to cordially invite Dr. Harishankar, who was amazed by his passion for his work, dedication for the profession, and attachment to the patient. I heard once you go to a house call, you spend 2-3 hours with each patient. So it is, unless you have passion, you can't sit like that. And to down here to help for the people. Welcome you, sir, and welcome Harishankar. And I was taken aback when I saw a book like this. It's not taught in medical colleges. Medical colleges talk about large volumes of theory. This practical knowledge equal to a postgraduate book he have written. Practically, was any of the doctors who are reading this book, I think they are qualified to get quickly MD Geriatric shortly. Similar books will be helpful for them to get a high quality medical stuff inside. Thank you for the presentation of the book.
Thank you.
And all points are simplified and given in a very detailed manner. And coming to the our association with our team members and doctors are welcome. You know, you understand we are the society. The earlier presentation, Rajkumar has presented about the increasing number of population, elderly care, and specialist needs they have, everything they have discussed in detail. Good data and good information for all of us to know about this. Here, you know, Venkateshwara Hospital, look at the heart of the city, the special for heart care and critical care. We are also training our staff towards elderly care and critical care. For example, in case of your house calls, you may need help. For example, an emergency ECG, or emergency echocardiogram, or emergency X-ray, some fall, you have doubt about the fracture, or an emergency ultrasound, some pain abdomen, some distension, you are not sure what is the ultrasound. Our team is available. That's what we are coming to. We are here to help you. And you can just order the test. Our person will come home. Our staff is trained for that. They can work with you, work under you with your guidance, take an ECG, give an opinion by a consultant. We have a team of 5 cardiologists. One of them will give opinion instantly within few minutes time. So that you get a good quality ECG, Philips only. We always have high quality machines here. So Philips ECG, all 12 channels, given by a cardiology opinion consultation, within a few minutes we will get it. By the way, we can share our experience and knowledge to help you to stand with your side and collaborate with you. It's a great assurance for you on our side. Similarly, getting echo at home, you know how difficult you would have seen. Getting echo is not that easy because moving the equipment, moving the doctor, getting a cardiology opinion. So those things we are strong and we are with you, all these things. And our team will be happy to share our experience also with you. For example, some of our patients, we are not able to reach, but with team members, we can share your house, your residential addresses with us, so that our patient also, you can go and visit them and help them, which we may not able to. We don't have house call service in our hospital. We look after our patients only. We don't have not launched any services so far. And so your patients, you need help, or our patients staying near your place, you can take care and help us also. It's a mutual benefit for both of us. And our staff are only trained for those things, and we welcome the association of the team and assuring you the patients will be sent back to you. Because it's not a corporate hospital. It is an individually owned and team managed specialist multi-specialty hospital. So we never advertise anywhere. You will not see in Venkateshwara Hospital advertisement anywhere. So we never advertise anywhere. And so by seeing advertisements, patient will move out to corporate sectors. Those things are not available with Venkateshwara. So we have your patients are with you only. It is not taken away. And even if you refer some sick patients, we will prompt it back to you. It is not taken by the corporate hospital. It's not like any other. The patient will not fall back. Even if they come here, we will send them back to you. Send them back to you also. Regarding your telling, Rajkumar telling about BP apparatus, I just take 1 minute time to explain things to you regarding BP. No, what is a common disease affecting the human being in adulthood? Can one of you tell this? Common disease.
Lifestyle changes. Lifestyle disease.
Depression is very common. Second common is the Global Burden of Diseases study published last year talks about number one risk factor for death of human race is hypertension. Number one risk factor. But most ignored. If anybody asks what is a common disease, they used to give the answer diabetes. Yeah, diabetes made it so popular. Everybody thinks of diabetes. Most of us have glucose also. But if you look at the data, India has 7 crore population of diabetes and 25 crores population with hypertension. Another 20 crores with pre-hypertension. Only 1/3 of the population are aware of this. In them also, only 1/3 are getting controlled. So we have taken as a mission to help people, to make them aware. For that only we are giving around 260 BP apparatus to village people. Village people is not individual person, but hotel, medical shop, barber shop, like that. outside people will reach there. So any even a vendor, vegetable vendor can have the BP papers and check the BP for the customers. And then we give BP paper 250, 60 BP papers we give so far free of cost for them to make them aware. So similarly, we have started the first hypertension center in the country, the opposite building. We'll take it there to show you more. It's a simple disease, easy to diagnose, easy to treat. Controlling BP can prevent stroke. Controlling BP can prevent heart attack. But controlling diabetes cannot prevent anything. Cannot prevent stroke, cannot prevent heart attack. But it can help you to avoid eye damage and kidney damage. You understand? So it is more important we feel. Then we also treat free education for children. Anybody +2 completed last year or previous year, there are 4, 5, 6 we can accommodate every year, free of cost. And if you have anybody, can also can join the BSc Physician Assistant course. And coming to our hospital, Venkateshwara Hospital, I share some of the videos.
Venkateshwara Hospitals began in the year 2003 in the heart of Chennai by the visionaries Dr. Pillai Vallal and Mrs. Leela Vallal. Ever since the inception, with the support and trust of our patients, we have grown and now are a 150-bedded hospital. We have around 130 well-qualified consultants visiting us regularly. Cardiac care. With an efficient cardiology team of 7 doctors, everything is made possible when it comes to heart care. Equipped with latest generation high-tech cath lab and 24 hours operational emergency and trauma care, we are able to perform angiography, angioplasty, pacemaker implantation, implantable cardioverter and defibrillator, cardiac resynchronization therapy, and handle any kind of cardiac emergencies. With utmost patient safety in mind, we use high-tech coronary imaging techniques like FFR and OCT to save lives. Obstetrics and gynecology. We conduct painless labors where patient delivers happily hand in hand with husband by the side. Multiporous labor, laparoscopy-assisted hysterectomy, hysteroscopy, a number of myomectomies and numerous other procedures are being performed successfully. Orthopedics, one-stop solution for all bone and joint-related problems. Minimally invasive knee and hip replacement surgeries are highlights of the department. General surgery. We perform a number of keyhole surgeries and our 24-hour surgical team is well equipped to deal with all surgical emergencies. Nephrology. The world-class dialysis facility at Venkateshwara Hospitals is a proof of quality care. We have twin theaters for kidney transplant, highly equipped with 0.3 micron filtration and laminar airflow system to minimize chances of infection and maximize patient benefit. Plastic and cosmetic surgery. We perform cleft palate and lip repair, liposuction, abdominoplasty, facelift, fillers, breast augmentation, rhinoplasty, and breast reduction with remarkable results. Oncology and oncosurgery. We have pioneers performing oncosurgeries with outstanding survival rates. Psychiatry. We have an internationally renowned senior consultant psychiatrist who is also affiliated with WHO. We have a good team of neurologists and neurosurgeons with excellent results. Other specialties are medical and surgical gastroenterology, urology, ENT, anesthesiology, transfusion medicine, dermatology and cosmetology. Equipped with advanced technologies in the country, we have astounding radiological and laboratory services. Venkateshwara Hospitals is empaneled with all insurance companies. Now, as another feather on our cap, Venkateshwara Hospitals has been awarded with the NABH Certification for excellence and quality in service and infrastructure.
Told you it's a multi-specialty with all the specialists and all features available here, and can refer back to you. Our tagline says, your health, our passion. It indicates everything is possible. This is the patient. The most trusted hospital for saving lives in this region and the center of excellence. And our values of personalized care. For example, everybody's diet is different. Everybody's lifestyle is different. So we focus on personalized care. And this is some of the data for the hospital. And these are some of the awards we have received and number of footfalls. The 24% available pharmacy, any drug is available. For example, even it's not available, within 2 hours you reach the patient, send the patient home with the drug will be delivered at residence. In rare drugs also, the pharmacy 24 hours, lab, ambulance, cath lab, dialysis, all are available 24/7. And all specialists, multi-speciality, cardiology, orthopedic surgery, diabetology, OG. Our obstetrics is very popular, it's very busy obstetric center with 3-4 deliveries every day. Our specialization is the husband should hold the mother's hand during delivery. It is there for the past 20 years. So the mother feels comfortable during delivery, no pain at all, there is epidural anesthesia. Unlike the fear of the mothers, easy comfortable delivery here. They come back with second delivery very quickly also. And most of them are normal deliveries. Because the charges are same. For both for cesarean and normal delivery, charges are the same. Dr. Madhiki Ramakrishnan is a head department of plastic surgery, so you know about that. He's a pioneer in the field. Some of the, because I am passionate about cardiology and cardiac care, some of the features we have discussed about it, and I think we for further meetings we will go through that. Any specific doubts or any specific questions, we are here to help you and clarify your doubts. Thanks for taking your time and attending here. Thank you. For the doctors who came late, just want to briefly tell about our facilities available, that all specialists available under one roof, and everything is possible. We are here to help you and take what you, and our team is available to work with the guidance and help to your request is being fulfilled, like echocardiogram or X-ray at home can be taken care of. Thank you.
Request Dr. V.S. Natarajan sir to felicitate Dr. Thilevalan sir for entering into geriatric care in a big way. We welcome you, sir. I request Mr. Rajashekaran, co-founder and managing trustee, to please come forward. So we get inspired. He might have jolly well chosen a good corporate job, like me would have continued, but he has chosen to contribute to the society. We get inspired, and his contribution to the Dr. V.S. Natarajan Geriatric Foundation has been immense. We want to felicitate him.
Thank Rajkumar for your brief introduction about my activities. Getting all the baby has come now. PG is just now arrived. That's nice. A few days back, I had the chance to visit the geriatric ward, and we both saying that those people are not saying the geriatric must go and see. This is almost like a special ward. When I started the geriatric ward and geriatric OP, and when I started MD geriatric in 1996, there were only 2 PGs were allotted. MD geriatric, only 2 seats allotted 25 years back. When I went last week, I could see more number of PGs than the patients. These 20 PGs are there available now. The Medical Council of India is going to give 9 seats every year. It is very good news for us. So every year we are getting 9 seats for MD geriatrics. I happen to see them. I took a photograph also. I invited all the PGs to attend the function, and I am thankful to them for coming to the function. Today's main aspect is starting a geriatric house call program. This is particularly new for the PGs, but this is evident for the geriatricians. Those who are taking the specialty, they must know more about the geriatric house call program. The story goes back more than 20 years back. When he retired in 1997, 2000, then 1990, I became a member of the Geriatric Society, Indian Geriatric Society. 2001, I became the chairman of the Senior Citizen Bureau. This is an NGO, more than 200 elders are member. I became the chairman of the Senior Citizen Bureau 2001. Then we started a number of camps, lectures, a lot of programs we can every year there will be some program. Then as a only geriatrician, I have to go for a number of house calls. So at the time I was having a one ambassador car and there is no driver. So I had to go myself to attend the elderly patients. Even after Audit I used to go, come for late dinner at 10:30, I have my dinner. So we started affecting my health. So I thought we can make some program so this will be viable for all the time. What I decided, I contacted all my juniors, my friends and other juniors and my students to join with this geriatric house call project. I told them our profession is very noble professions, and just give you 5 or 10% of time and money to the profession. Everybody agreed. You don't believe it? At that time, 30 doctors, nurses, and physiotherapists joined in the program, and we started the geriatric house call program 2008. You remember 2008 we started the program. More than 20 doctors and nurses joined with that. So we prepare a manual also. Few years back, I started with the help of Dr. Harishankar. He is almost authority on house call. He take it as a patient to go and see the patient in the house. He is dedicated and he spend more than hours to sit there and treat the patients. Actually, he carry a lot of things in his car, the suction apparatus, oxygen cylinder, everything he carry. So he became authority on the geriatric house call program, and we have now more than 10 years. We have seen and we have treated in the house more than 10,000 patients in the whole house. More than number, more than quality. The quality of service is more important. More than 10,000 we have seen, but thousands of elderly people as life have been saved. That is more important. Police's life have been saved because of this house call program. So this is a very important program. Those who are taking the special geriatric, it is a must for them to go and see the patient in their own house. Seeing a people in the OP in the wards is entirely different. By seeing the same patient in the house is entirely different. You can see the whole atmosphere different. A lot of attendants, the relatives are there, a lot of questions they will ask. But you learn more. When you see a patient, you see only the disease. When you see a patient in the house call, these and the community and social problems, you see a lot of things. So it is a welcome project. And Dr. Harishankar and Ritika, she was a student in my unit. They have prepared a manual, as Dr. Telly also, you must see the manual is thought-provoking. You just see the manual, it helps you a lot how to treat the elderly people in the emergencies. So I thank Dr. Harishankar and Ritika for preparing this manual. So now I request Dr. Harishankar to come and give a talk about the house call program. Thank you very much for your presence in this function. Thank you.
A very good afternoon to one and all persons over here. At the very outset, I'd like to thank Padma Shri Dr. V.S. Natarajan Geriatric Foundation and Venkateshwara Hospitals and MMC Pharmaceuticals for giving me this opportunity to meet you all. And this next few minutes or so, I'll take you a world of community geriatrics where you'll be treating elderly at their home. It is not going to be much different for science. For the past 1 lakh years, the human beings have not changed. Several structures have changed, but nature has not changed. Because whenever when you see your pharmaceutical friends and medical representatives, they used to present you a book. This is a newly updated book, 2021, 2019, 2018. So you need to get updated. You can need to be updated. The treatment gets updated. The drugs gets updated. As you all know, whenever a new drug comes, it's after the homicidal of the previous drug. So nothing has changed in the past 1 lakh years. The human beings have remained the same. So we'll be going to a world of elderly where we'll be seeing them at their home. Nothing much has changed. We'll go through. So I've used a lot of photos. So please do not take photograph. I've taken a video of this. If anybody is interested, I'll give them later. So this is the place where we are coming from. We are coming from Old Pallavaram. And this is the first time when I met V.S. Natarajan sir in the year 2013 regarding a geriatric house call project. And this is how even right now it works. It works through telemedicine. So initially the complaint is registered to a telecaller. The telecaller assigns for a visit. They assign for a doctor. We have a huge list. This PDF is very, very famous. The doctor-wise name, the area-wise name, the associated hospitals is listed, and the nearest doctor is assigned for the visit. That is how the foundation works for the geriatric house call project. And so we need not take as far as in Chennai Metro is concerned, we have so many pin codes. For at least each doctor can take in charge for 5 pin codes. So which is very close to them, just for an understanding. And right now, to do a geriatric house call project, you need little bit of team effort as you need in a hospital. So you need the greatest strength will be on the staff nurses. So a physician, physiotherapist, like-minded surgeon for you to help, because medicine is broadly divided into 2 specialties. One is general medicine, one is general surgery. All other super specialties, though can be called as super specialties, should be considered as a subspecialty of medicine and subspecialty of surgery, because you need 2 separate specialties. One is medicine, one is surgery, to solve all the problems of elderly. And the major chunk of, I see a lot of staff nurses here. My sincere thanks and gratitude to you, because geriatric house call project will be incomplete without the help of staff nurses. And this is how we do a model, and according to the foundation's geriatric house call project, the call is received and the problem is assessed, whether it is emergency call or which is a casual call, because they might be calling for a general house call, or it can call for various reasons like fall, fever, unresponsiveness. We'll go through that later. And definitely you need to take an audit, so that where we can improve, because for a hospital it is a regular organization, for a house call it is an irregular organization. So we have to keep it organized, so that we can reduce our mistakes in the days to come. So after a house call elderly, we should all imagine and believe that life cannot be saved at all times wherever the hospital they go, or whichever the super specialist doctor treats. Life, death, birth is inevitable. So that cannot be changed. So once you see an elderly, we should not be very adventurous telling them after doing this you will be saved, after this you will become normal. Because the discharge criteria for elders differ from the discharge criteria as you see in hospital. For discharge criteria in hospital, the wound is alright, the scar is evolving, and the patient starts walking, rehabilitation and discharge. Whereas in elderly, there is no standard discharge criteria. After these days, I can discharge the patient back to the society. That can never happen. So you need some adjustments in the discharge. So only you can reach an optimum level. Whenever there is a problem with elderly handling at homes, you should assess triage. Yeah, because certain red flag signs are there, like coffee brown vomiters and patient sinking, the earlobe sign, which we will show you shortly. So the reality has to be explained. Suppose you have a stage 4 carcinoma patient with metastasis all over the body, we should not give them false hopes. So the option of DNR, do not resuscitate, is medico-legally safe, valid, approved by the court of law also. So the real outcome should be explained to the ward's children, and the outcome should be taught. But if there is a treatable condition like hypoglycemia, hyponatremia, so the first option for medical legal purpose and for all humanitarian reasons, the first option of hospitalization should be given to the attenders. If they feel that their parents, their grandparents are so fragile and elderly, they do wish for a last breath at their home. If they will for a home hospitalization, after receiving proper consent that they want their parents or grandparents to be treated at home, they can be going for a treatment. But once you take a decision both from the attenders and as a physician to start home care, you should be fully equipped with the semi-fowler's cot, the nurses support with good diaphragm maintenance, records maintenance, intake output chart. So everything has to be done. So generally, doctors visiting home are generally seen as they get a stepmother treatment. But when I saw, after traveling some 10 or 11 years down the lane, a consultant visits various hospitals. It also takes time, traffic, signals, car parking. He has to park the car, take the floor, take the lift. I feel it is much easier. It is so for those who feel that going to a hospital is more easier. But I feel after traveling 11 and 12 years down the lane, going to home is also easier. Sometimes you will be, you might feel disagreed that this is some way. Once you go home, it will take a lot of time. Only the first visit will take a lot of time. After the first visit, the consecutive visits will take less amount of time. So you would have seen these in the past, yes. And yes, doctors visiting home also has become like this, something with some memories and a lot of enthusiasm. So you will be received well because it is now off the fashion for the past 2 decades. So once you go home, you will be received well. They will say, no other doctor has came to my home. I have requested so many doctors, but all of them have shut down. So you will be really received well and well. So this is my experience after 10 years, and this is how we work. And a small story of mine, I was aspiring PG aspirant, so I have written at least 6 entrance exams for my PG. All of them I failed, and they started issuing negative marks. So that is how I visited as a factory medical officer. I started my career, and then I met my mentor in one of the geriatric conferences. Please do attend Gericons regularly. You will be updated regarding all the scientific data regarding Gericons are organized by medical colleges of various states in India. So that's how you slowly learn. And regarding the management of elderly at home, hyponatremia needs a neurologist care, an intensivist care. How can a home care physician, a physician with MBBS or MD, is he valid to treat medico-legally and professionally? Yes, it is medico-legally and professionally valid because there is a paradigm shift in the management of ICUs. You know, always ICUs do not, visitors not allowed, visitors no entry. There will be, you know, which is the most deadliest weapon or deadliest instrument in a hospital? It is the stethoscope with lot of bacteria. There are a lot of studies supporting this, and there is a paradigm shift in the management of patients in the ICUs in the West. Because ICU psychosis is the biggest problem that elderly faces when they are shifted in a hospital and they are not allowed to see elders. Already they are admitted with delirium, with hyponatremia, and not allowing their relatives to come and see. ICU psychosis, I hope all the hospital inmates could have experienced. You have needed the handcuffs, side rails, restrainers, lot of those things. All this will be reduced, and exposing an elderly at home, the sunlight will bring him more orientation than the orientation in an ICU. These are all scientifically backed. So who utilizes you? Your co-physicians in the various hospitals, surgeons, oncologists, orthopedicians, all, and your colleagues who will be working in abroad, they might ask to go and see my parents, grandparents. Yes, this is just for job opportunity purpose. And like for elderly, you need an outpatient care also, you need an inpatient care also, you need a home care also. This is just to differentiate. So what helps the patient wise, how they are helped when they are seen in a house call? Whenever they are seen in a house call, whenever they are receiving, they are coming to the hospital, they have lot of problems. The moment their time comes on the token number, they might rush to the restroom, or they might soil the place, the hospital, with the stools and urine, and there are a lot of nosocomial infections, because as you all understand, elderlies are immunocompromised. Our doctor also has rightly said diabetes, hypertension, 1/3, 1/5. So all lifestyle diseases are immunocompromising. So for them, visiting a hospital with the chances of nosocomial infections, all these infections can be reduced by a single visit of the doctor at home, and for a doctor to do a diagnosis. Because in a hospital with the case sheets, you will have lot of opinions pumped in, and there is now because in some hospitals alone you have a team discussion regarding a patient, especially a very sick patient. The neurologist sits, the physician sits, the critical, there is a board meeting. But nowadays board meetings are also becoming sparse. With all this discomfort, as a house care physician, as a home care physician, single-handedly you can take diagnosis. When there is a problem, we can take the help of seniors like Dr. Suthilevalan sir and various physicians in various places, as doctor has already invited us to take the help for various reasons. So already the one of the senior representative has mentioned, geriatrics will be expecting a peak practice by 2025 and 2030 because of reduction in death rate and reduction in the birth rate. The graying of the nation is expected more. So this is to ensure you to take up the field of geriatrics for the postgraduates, especially who have felt that I didn't get MD General Medicine just because of my rank. I have come to geriatric medicine. So please don't have any regrets. This is one of the best field, and as far as everything is concerned, both finance, both your job satisfaction as a physician, everything you will be satisfied. So now we will be entering into a house call. How do we do a house call? You should get an informed consent that this person will be getting treated at home. Need not waste much time on this. Basic details like name, age, sex, identification number, some PAN card number or Aadhaar card number to know whom we are treating to. We have to check the basic vitals of blood pressure in both sitting and supine, because in elderly this orthostatic hypotension is very common. So please take blood pressure both in sitting and supine position. 1 minute pulse rate, please, and in this purpose definitely you can believe on your pulse oximeter. Many times it gives an excellent pulse rate recording and saturation recording, blood glucose, and please always see the conjunctiva. Many times elders will having pallor. Please examine the aortic area as far as CVS is concerned, because many elders do have aortic stenosis and many times murmurs, and that might cause easy fatigability and the general decline of elderly. Nallada irundadu kadanda or 2 varama nadanda moochu vaangudhu, he is not as before. So aortic stenosis is very common. For respiratory area, please check for bases. They might have gradual onset of pulmonary edema, slowly starting with little bit of crackles. Per abdomen, always please check for the bladder area. Several times they are with a full bladder even up to the umbilicus, and you will encounter them as irritable elderly syndrome. The elderly is not sitting anywhere, he is pushing. As you know, whenever there is an option of given a good lunch and a restroom, which you will prefer first, you need to empty your bladder. With a bladder full, never you can release even the best of the foods. So that is the base of causes for acute restless elderly. So please examine the bladder area, umbilical area, and the groins for bowel sounds and any obstructed hernias, because elderly are generally they are neglected. Never like for child we generally pamper, we touch, we squeeze them, we touch, we put them. Elderly are never done so. The veshti and the sari, what the nighty what they are using will always cover all the important parts, and you miss the important structures like umbilical hernias and inguinal hernia. CNS look for gait, rigidity, weakness, balance, because Parkinsonism is an underreported disease. The Parkinsonism what we see in hospital is only the tip of the iceberg, because many times these symptoms are taken as part and parcel of aging. That is rosary sign, the pin rolling movements, the slowness, the paucity, rigidity, tremors, depression, constipation are never taken as signs of Parkinsonism. They are understood as otherwise elderly, vayasana ipdi dhaan irukum. Please always check the lower limb. You can see edema, cellulitis, ant bites, several times ant bites, intertrigo. What are all the expected emergencies that you are likely to see are falls, fevers, unresponsiveness but breathing, unresponsiveness completely, different behavior, cancer, lower limb stories. Falls, generally the fractures are related with the femur fracture, the commonest fracture, then the spine compression fracture, the radius ulna getting fractured in the order of priority I have mentioned. So whenever there is a fracture, please ask them whether the elderly was walking already, whether he was doing these activities of daily living, bank if he has done already, please suggest him a surgery, because surgery will get him back his normal life. If he was already bedridden with the assisted living, he has slipped and fall when nobody was there, surgery might invite more trouble. So fever in elderly is very common, as you all know in general medicine, above the umbilicus, below the umbilicus. So above the umbilicus you expect gram-positive bacteria, below the umbilicus you expect gram-negative bacteria. Commonest infections are URI, LRI, TB is also very common in elderly. It is not an uncommon disease. And below the umbilicus, urinary tract infection, pyelonephritis, diabetic foot and bed sores are very common. Unresponsiveness but breathing, the elderly is still breathing. It can be hypoglycemia, a CVA or a hyponatremia. All these are treatable both in the hospital and at the home. It is treatable. So get a consent, know about the inevitability of death and explain regarding the pros and cons, and then start treating them at home. For issuing death certificate, never decline giving a death certificate if you know the family already. Please, if you don't know the patient already, never issue a death certificate. Because issuing death certificate is not a problem, but it is a responsibility by the court of law for a physician living in and around the doctors, and in his working office hours, it is a responsibility of the physician to issue a death certificate. Look for medical records. Look for the members. Are they crying? Are they having a sad face? Because you can expect lot of foul play in elderly, because the grandfather would have written, all my children and grandchildren can they can enjoy this this property only after the grandmother's death. So grandmother is an obstacle for enjoying all this property. The grandchildren nowadays, they are very cunning. Now a lot of foul plays are there. Please look for the family members, any mysteries. But this is not to frighten you. Please take a closer look. Please issue death certificates and Form 4A. Please maintain a duplicate copy. Issue only in office hours. Please maintain photo evidence. Unresponsiveness in breathing, hypoglycemia and those things we have already mentioned. Regarding the different behavior, it can be hypoglycemia again, hyponatremia, neuropsychiatric drugs that the elderly are already taken. To treat the cause is very important. You have to withdraw the drug, which is because once the elderly would have been very aggressive, they would have been taken to a psychiatrist, they would have been prescribed haloperidol, olanzapine, mirtazapine, but after a point of time, the snake has lost his tooth. And after that, the elderly are no more aggressive. But maintaining the same doses of mirtazapine at 15 and 7.5 will be too much for the elderly, and he will start aspirating, coughing on eating, and slowly he will decline and end in death. So the psychiatric medicines, yes, the elderly could have been aggressive at a point of time, but after psychiatric drugs for a long time, they would have reduced. Cancers, yes, it is very much in elderly. All cancers are more common. As the lifestyle diseases are more, GI malignancies are also expected more, and metastatic cancers. And you know, for cancers only palliative care is more than sufficient, giving IV fluids, catheterization, trials tube feeding. It's a nurse's job, excellent job. Never regret for going to a house call treating an elderly. It is always very good and rewarding. Lower limbs, yes, pedal edema. Pedal edema, as you know, the 5 common causes: anemia, liver function test, your echo, where the EF can be low, the creatinine can be more, or the TSH can be hypothyroidism. Please look for these 5 causes. Very common in elderly. You can pick up lot of stories, because several times we never take time to look the foot, because dorsalis pedis artery, posterior tibial artery is very important and palpating to check a diabetic foot. Seeing an edema also is very important. So this is a rough idea of giving a house call project. Is just to see that females are more living in elderly, so we expect to meet more parties than tatas, and several times it is 80 to 90 years that they are more alone in home. Several times you will be called for a routine checkup, fever, falls, confusion, and several times you will get a call for life certificate also, that I am alive at 87 years, I need to receive my pension, please certify that I am alive, I am non-amulatable. So this is just to give a rough idea of the clinical photos. Vertigo is very common, pressure sores are very common in elderly, Parkinsonism also very common, and the COPD also is common, because all elders, though they look very pious and very saintly at this age, would have been already smoked for 40 years. 40 years, 50 years they would have smoked. Only they, when you ask, I don't smoke, they say. Then only the wife will come, illa அவர் விட்டு 2 வருஷம் தான் ஆகுது அப்படின்னு சொல்லுவாங்க. டாக்டர் பிடிக்க கூடாதுன்னு சொல்லிட்டாரு, ஸ்டென்ட் வச்சிருக்காங்க ஹார்ட்ல, அதுக்கப்புறம் பிடிக்க வேணாம்னு சொல்லியிருக்காரு. ஆனா அவங்க போட்டிங்கன்னா பட்டை கிட்ட அடிச்சு பயங்கரமா இருப்பாங்க. Don't get deceived by the book of cover. So prevalence of chronic kidney disease, there will be happy couples also, husband and wife living alone, but still they are very happy because they are not with the 10 sons. I mean tension, no tension. So all the sons are abroad, they in UK, US, living alone in a isolated families there, because there you cannot have such a huge get-together. So still there are several couples very happy, and they're taking very care. And you will also see elderlies in this model also. Sarcopenia, very common, that is loss of muscle mass. They also like to take photos. You are all having your cameras, please take some selfies. They enjoy, because nobody comes them to take, other than Aadhaar card and PAN card, they have never been photographed. So please go take some photos. They also enjoy, send to their wards children. They will say, doctor nama doctor nalla paathukkararu, ammaoda ninnu photo la eduthukkar, will be rejoiced. And yes, this is just an acute retention of urine. After catheterization, they feel very good. Unattended gallbladder stone, what we saw in fat fertile females in 40s, after that the same 40 female would have become 40 now, and that single big gallstone would have come and dislodged in the gallbladder neck and giving right hypochondrial pain. Several times we will take the help of the hospitals to do a laparoscopic surgery, because here home treatment will not help, they have to be shifted. And old Parkinsonism patient, for some time they will be meeting the neurologist. For years together they will be taking same levodopa 5 times, 4 times, but the same dose will not be essential, because as you all know, Parkinsonism is a neurodegenerative progressive disorder. The disease progresses, but the volume cut at that time will not be helpful. They might be ending in hallucinations with levodopa and carbidopa. So the prescription needs to be monitored. So that is very important. And you will see all like these kind of faces. You will get daughter-in-law coming by enga maamiyar eppa paathalu enna paathu ipdi pandra. It will be like part and parcel of Parkinsonism. You will get this kind of faces also. And old stroke patients, if they are because of atrial fibrillation, after some time with depression, they would have stopped all drugs. 3 வருஷமா எந்த மாத்திரையும் போட்டுக்கிறது இல்லை. AF-ஓட மாத்திரை like Cartron or blood thinners, nothing they will be taking. They will be ending in recurrent strokes. Already we know strokes are recurrent, and the elderly stopping tablets after some chronic depression. என் பையன் யாரும் என்கிட்ட பேசுறதுல, காஃபி தண்ணி வைக்கிறதுல, சாப்பாடு கேட்கல, அந்த மாதிரி ரொம்ப they are depressed, they will stop all drugs. Please go restart the drug, whichever is very essential. Stages of bed sore, diaper rash, because you know they are all looking very neat outside, but they could put Huggies from 24/7, constantly snapping the genital area. You can expect diaper rash. If left, they will go for decubitus ulcers. Wagner's grading, stage 1 to 4 holds good even in decubitus ulcer. You can also help certain children with muscular dystrophy, because there is a chance to go to home, and for these things also you will be called in for. And I like to acknowledge Padma Shri Dr. V.S. Natarajan Sir's Geriatric Foundation, with the help of Mr. Rajshekhar, also the co-founder and managing trustee, for giving me opportunities year after years. So I'm very thankful to them. He is my teacher, Professor T.L. Andumani sir, who is my anatomy first year class teacher, who has asked me to document everything, whatever you have seen. It always holds good, because in the case sheet I will write whenever they come in OPD, that time they were listening this song, that song, whatever I note I will write. Next time நீங்க நான் வரும்போது இந்த பாட்டு தானே கேட்டு பாருங்க, எங்க டாக்டருக்கு எவ்வளவு ஞாபகம். So you will be really welcomed well. And this is the first time when I met Dr. V.S. Natarajan sir. Probably you will see 10 years back the lane sir, this photograph. And my sincere thanks to Professor T.S. Kanaka Madam also, who is a neurosurgeon, and she has also helped our center in a big way, supporting in all possible help. And this is our center staff. Our center staff, the biggest strength of our center are staff nurses, because they are the spoke of the wheel, and I always, I never ask them, nurse paatha podum na solla maten, nurse paapanga, appuram indiki solvanga, nurse dhaan paatanga, and daangra vaartha nurse la kandipa payanpadutha kodadu, because together you win. A hospital will never breathe without staff nurses, because I see, understand doctors without any idea, they do have some superiority complex always. So that should be lost. Together we are a team, both with the non-medical worker, the paramedical, and together we have to work good, because in a house call it is very, very essential. And this is my family, my father, my mother, my sister, my daughter, and all of them have helped, because sometimes you need to go in orders. With the family support is very helpful. And this is the Pallikarnai marshland, which is very close to our center. Whoever are interested in watching, observing, having one-day observation at our center, you are welcome to visit our center to know our routine, how they are working. And after coming here, this is a small new this is tourist spot that is open near our center, Pallikarnai marshland, Sadupu Nilam. So you can visit this place also. Thank you for your patient listening.
Brilliant, I really appreciate that. Amazed with great talk. We appreciate his passion for his profession. A lot of interesting points, and you also learned from him. Great, thank you. Master teacher. Thank you. Create a small token of thank you for you. Thank you. Thank you. Thank you. Excellent. Thank you. Keep it up. You understand the passion drives him. Thank you. Thank you. Thank you.
Thanks a lot, Dr. Venkateshwara. Our discussion is the second time we are listening. Last time we had in hotel Geriatric, I think we had a good number of candidates. This is the second meeting, sir, this year. This is the second meeting, sir, this year. The first meeting was in hotel JP.
Yes, sir.
A good number of participants was there. We had an opportunity, excellent opportunity to listen to you, and all those PG students of the Geriatric, those who come forward here would have got benefited from this. And I personally had an opportunity to visit a couple of times to the center, worth visiting, and there is a significant contribution. We request you can go and make it. There are a lot of opportunities sir gives. If someone who is not able to, someone wish to do contribution to the society, but we don't know how to do it. There are opportunities provided by them. So you can feel that you can also contributing to them. That's another way we can satisfy ourselves. And we have a small video of 5 minutes on Gate Watch. This place has been visited by Dr. V.S. Natarajan, as well as ICMR certified. Central government has funded this project. That's why the certificate comes with the Government of India certificate.
Engineering Solutions. PSG Cares is a DST-sponsored center of excellence. Established in 2019 at PSG College of Technology, it strives to develop innovative and cost-effective wearable, smart healthcare solutions. The research team of PSG Cares has successfully developed a couple of wearable healthcare products like Wing, a wearable navigation guidance kit for Alzheimer's patients, Phyton, a wearable virtual physiotherapist, and a prescription reminder for elderly with memory impairments. A few more projects like Parkinson's severity grading and early warning of diabetic neuropathy are underway. One of its innovations, the wearable gait monitoring and fall prediction device, GateWatch, is an indigenously developed patent-protected innovation of PSG Care supported by DSTC division funding under the scheme Technology Interventions for Disabled and Elderly. GateWatch attempts to replace the sophisticated, scarce, and costly gait labs with an affordable, simple, and easy-to-use technology. Accurate measurement of the spatio-temporal parameters associated with the walking phase of a human being give vital clues to medical practitioners about the personalized medical interventions needed for patients suffering from various neurological and orthopedic ailments. GateWatch screens patients with geriatric, neurological, or orthopedic conditions for their stability problems, resulting in timely identification and avoidance of an imminent fall, thus saving huge cost as well as mental agonies of the family members and caretakers.
Falls are a main cause of morbidity and disability in the elderly. More than 1/3 of persons 65 years of age or older fall each year, and in half of such cases the falls are recurrent. Do you know more than 60% of elders above the age of 70 years fall down due to gait imbalance? Of that falls, 80% result in a hospitable injury or fracture. Few of them are fatal as well. Falls may be either due to extrinsic factors like environmental hazards, poor lighting conditions, etc., or due to intrinsic factors like neuromuscular degenerative disorders, weakness due to aging, gait disturbances, cognitive impairments, etc. Gatewatch is designed for the second category of falls. It estimates the fall risk score of an individual taking into account all possible intrinsic fall risk factors, including spatio-temporal gait characteristics of the individual accurately captured over a trial walk session. It then provides a combined fall risk score taking into the qualitative and quantitative fall risk factors using an innovative fall risk assessment model developed by the research team.
Gatewatch is a wearable gait assessment and fall risk prediction device designed for elderly and by and large for people suffering from movement-related disorders. It is a simple and effective solution to conduct accurate assessment of the gait quality of an individual in just a few minutes. Here is how the gait test is conducted with Gatewatch. The device is fastened to the patient's knees on both the legs, and they are asked to walk for about 30 seconds in their usual pace. The details of the patients and their pre-medical conditions are captured through the Gatewatch mobile app. Once the brief walk session is over, their gait report is generated, which includes the accurate values of the various gait characteristics, the gait type, and the fall risk score generated using an enhanced fall risk assessment model. It also monitors the effectiveness of the therapeutic interventions and recovery progression. Here are some of the expected beneficiaries of Gatewatch.
The device was selected by the DST for mass production and commercialization in May 2020, and a press note in this regard was published in PIB portal of Government of India. On seeing this, AGNA Inc. was interested in acquiring the technology from PSG Tech, and an MOU was signed between the college and AGNA Incorporation on the 25th of September 2020. The research team obtained the ethical clearance for human trials by Institutional Human Ethical Clearance Committee of PSG Hospitals in January 2021. Since then, field trials and clinical trials are being conducted, and the reports generated are validated by leading medical practitioners. The trials are being conducted at Orthopedic Department of PSG Institute of Medical Science, Salem Neuro Foundation, Stroke Rehab Center of PSG IMSR, as well as in few other physiotherapy centers on more than 700 patients till date. And the study is still going on.
Watch has already received many accolades from the medical fraternity. One of its greatest recognitions was being an invited exhibit in the Indian Medical Association's Tamil Nadu Chapter Conference TEMACON 2021 hosted at PSG IMSR during 11th-12th of December 2021. Gatewatch has now reached full-scale commercialization stage, and we are waiting to see the mass production and commercialization of the device so that it can reach out to the needy at affordable cost. Let's join hands to provide solutions for healthy and happy aging.
Of patients who have risk of falls, when you give this CES, it helps to reduce your rigidity level, especially for Parkinson, because of the neurotransmitters getting stimulated. So dopamine release happens. So it helps to reduce the intake of medicine, basically. So people who have risk of taking too many medications, like to avoid polypharmacy, this is of great help. And even young people who are having fall risks. I saw one person who are having epileptic attack frequently. Many medications was given, but the falls could not be prevented. But after taking this CES therapy, by the second week, the patient started walking comfortably, both indoor and outdoor, without any